Good afternoon. Can you all hear me?
I can hear you.
Oh, awesome. Kinsey, are the people in the room?
Yep, you should be good to go.
Okay, thank you. Good afternoon, everyone. My name is Jeanette Towns, and I am a certified recovery support specialist and a mental health advocate here at NAMI Northern Illinois.
Hold on, Jeanette, it muted you. Oh,
Okay,
there you go.
I don't know where my picture went. Okay, I'm back. I would like to tell you all a little bit about NAMI. NAMI is the nation's largest grassroots mental health organization. NAMI is about 40 years old, maybe a little bit older. And at our Northern Illinois chapter, we provide education, advocacy, support groups for all types of situations, either for the mentally ill or for their loved ones or caregivers. We have all types of things to help educate the community and let them know, teach them more about mental illness. So, May is Mental Health Month, and we have a lot that's happening around the community. Upcoming, we have May 21st from 4 to 8 p.m. at Cliff Breakers. We have our annual Building Bridges event, which with the support of the Winnebago County Community Mental Health Board. The guest speaker will be Jamie Tawaski, founder of To Write Love on Her Arms. And finally, May 28th, we will be holding a free psychiatric advanced directive clinic with the Guardian and Advocacy Commission, where attorneys will be helping you fill out directives. The event will be held from 5:30 to 8 p.m. at 4317 Maury Drive in Rockford. Today, we have with us Lori Davie, who is the program manager for the Autism Program, or TAP, at Easter Seals and has been employed by Easter Seals for over 22 years. She has both professional and personal expertise in understanding and working with families of children with disabilities. Davie's primary role is to synchronize the clinical services, trainings, and community outreach for the autism program at Easter Seals, as well as to coach parents of children diagnosed with an autism spectrum disorder on a wide range of topics, including coordinating relationships with providers. She is also responsible for managing the budget of the program. Lori received her BA in psychology with a minor in healthcare administration and child development. She is on the CME QI committee as a parent representative for the Illinois chapter of the American Academy of Pediatrics. Today, she will cover an overview of the growing diagnosis of autism spectrum disorder, how to recognize the psychological characteristics that ASD may present, and how they are often misinterpreted as adverse negative behaviors. And she will talk about all of the Easter Seals Rockford programs. And I would like to let the audience know that you can ask your questions in the Q&A feature throughout the presentation. And then at the end of her presentation, I will help facilitate and read your questions. Thank you for being here today, Lori. Take it away.
Thank you for having me. I'm so excited to be here. I see some familiar names on the guest list and attendees list, so welcome. And I also just want to say before I get started, if you can attend any of those events that Jeanette just mentioned, you'll be so happy having resources and connecting with other people and families on the same journey. are just extremely important, and it really takes all of us together to find resources for our loved ones. NAMI is a phenomenal resource in our community. Danielle and her staff do an outstanding job. So thank you to NAMI for all the work you do. We are greatly appreciative. And with that, could I just have people put in the chat or the Q&A if they're a parent or a professional, how does autism impact their life? And while they're doing that, I will share my screen. Can you guys see my screen okay? And Jeanette, can you tell me, and I can't see the chat now that I'm sharing, can you tell me what people are saying, parents or providers?
Okay, the first one, which is KT, she's the parent of an adult child with ASD.
Okay,
AV says she's herself a parent and professional. And KG says grandparent of 2 children with autism.
excellent.
JG says parent and professional.
Okay,
And that's all we have so far.
okay. Thank you for your input. That just kind of helps me know different things that I need to share. So today we're going to learn about autism, and Jeanette talked about some of the objectives. So the Autism Program of Illinois is a network of providers throughout the state of Illinois, and we are one of the service providers here in the Rockford area. We have many services that are eligible. Our main focus is children, but we do get tons of calls for families who have adults with autism and they're looking for services. So if that's the case for you and we don't have the service here, we will help you get connected with the adult providers in our community. So throughout the presentation, you'll have or at the end of the presentation, I put my contact information. So call us. If there's something that we don't offer, please call us, because between NAMI and ourselves, we will help you get connected to the services that are appropriate for you. So our funding, as I mentioned, is through the Autism Program of Illinois and the Department of Human Services. This is a required slide, so I just got to quickly go through there. Jeanette actually just read this, so this is a little bit about me. I'm going to skip through that. And then I'm just going to talk briefly about some of the facts about autism. And not too long ago, probably 3 weeks ago, the prevalence rate for autism was updated. So 1 in 31 children are currently being diagnosed with autism. They did a research study on 8-year-olds throughout the country, and that was the prevalence rate that the Center for Disease Control and Prevention listed. And they also listed that 1 in 45 adults are being diagnosed with autism in the United States. We also know that autism is 4 times more common in boys than girls, and this is true for the adult population as well. What we are seeing with girls on the spectrum, that oftentimes they're diagnosed much later. Girls tend to mask the symptoms a little bit more than boys, or are often misdiagnosed when they're younger, and then once they get a little bit older and find qualified professionals to help diagnose, then they're getting the diagnosis. Some other things that we know about autism is that it's a complex disorder. Typically, the symptoms must be present in early development. So a lot of times, I think on the countrywide average is 4-year-olds to people are being diagnosed by the time the child's 4, but the symptoms are present much earlier. So that's a lot of family stress that families go through, wondering or researching or trying to find services to get their child diagnosed. Um, when we look at autism being a neurological condition, when you hear the word neurological, you think of the brain and central nervous system and those systems communicating with each other. So oftentimes there's atypical communication between the brain and the central nervous system. And then it's a spectrum disorder. For those of you who've been around the autism community for a while, you may have heard, if you've met one person with autism, you met one person. While the diagnostic criteria is very similar and they have to meet certain criteria, if we line 10 individuals up, their needs would be completely different in all 10 of them. So I really like to spend time focusing on how we diagnose autism, because that will help you understand some of the misconceptions that exist in a lot of those behaviors that we typically see. We often hear or see that children with autism are, they're getting trouble at school, or they're getting notes sent home, or for little ones, they're getting kicked out of daycares and things like that. So we want to truly focus on the criteria for autism, which makes them eligible, which then will also generate the treatment that they need. So there's 2 areas of what we call core deficits that we look at. If you are not familiar with the CDC website, there are tons and tons of resources for not just autism, but some of the other mental health conditions that we'll talk about, co-occurring conditions that we'll talk about later in the presentation. But it's a great resource. They have screening tools on there if you're wondering if your child has autism. For adult children or for grandparents, there's resources there as well. So check that website out. Just type in your Google search engine CDC and autism resources, and you'll be super happy that you did. It's a great resource. So we're first going to look at the first criteria for autism. And I'm going to call this category A. And we focus on mainly social and communications. So when we have somebody go through our diagnostic process, they have to meet criteria for all 3 of these areas where you see 1, 2, and 3. So the social emotional reciprocity, that's the back and forth of communication exchange or an emotional exchange. It can range from the failure of having that back and forth conversation, maybe not sharing, if we're having a conversation and I'm saying, I want to go see the new movie that's happening at AMC this weekend, and the person I'm talking to just only wants to focus on trains or something that's not related to the topic. Emotions can be, they're not sharing their emotions, or they aren't aware of their emotions. Failure to initiate or response to a social interaction. So everything under that category 1, I'll have some examples further in the presentation, but when you look at number 2, that's more of the nonverbal communication. That's the could be, if I could see you right now, I can't see everybody on the screen, but if If somebody was looking at their watch or yawning, that would be my nonverbal communication that I may need to make this presentation a little more fun, or, I'm not, maybe I'm talking too much, I'm not interacting. So your nonverbal communication will help me adjust how I'm presenting in the conversation. So people with autism, they struggle with those types of reading nonverbal communication. Sometimes we use a lot of nonverbal communication, and if the person with autism doesn't understand, that's also how some of those misinterpreted behaviors can happen. Finally, in this category, deficits in developing, maintaining, and understanding relationships. And I think this is really big because a lot of us parents and professionals have worked really hard to help our students or clients or loved ones learn how to approach somebody and say, do you want to play? Or, that initial introduction to a potential friendship. The area that I get the most calls is the maintaining that friendship or relationship, and just even social opportunities. So I would even say for our program, after screening and diagnostics, our number 2 request for services is social skills groups. And this would be the area why. So I'm going to go to the next slide. So some examples under that social communication would be the reciprocity, the back and forth, the social approach, even knowing when a conversation ends, how to do that. Like, some people with autism might say what they have to say and walk away, even though their communication partner might have more to say, so that could be an area that may be a deficit for the person. Back and forth conversations, sharing interest. I could talk about gardening all day, and if I'm not listening to what your interests are, that could be a problem with the conversation. I talked a little bit about eye contact. Body language is really big. If you're not able to pick up on somebody's body language, let's say a teacher is in front of the classroom and trying to use her body language to say, what you're doing is not okay. Maybe I call it teacher look. If a person's not able to pick up on that, and maybe the teacher even looks funny when she's doing it, the person may laugh. And so there could be another misinterpreted behavior when it was just really a misunderstanding of that body language. Gestures are big. A lot of times, again, we'll use our hands to talk, or we'll point and say, can you go get me that book on the shelf? And they're not able to find or follow our gesture. So again, that's where some of that misinterpretation of the behavior could be, because they just don't truly see or understand where we're trying to point or guide them to. Developing and maintaining relationships, I talked about that. And then one area that I didn't talk about was difficulty understanding non-literal language. So many of us use sarcasm or idioms or things like that when we communicate. And a lot of people with autism are very literal, concrete thinkers. So I'm sure we probably all could tell examples of again, our clients or students or loved ones of things that we say that they may not fully understand. And then that can cause some of that misinterpreted behavior. I have a 25-year-old daughter with autism, and I remember when she was little, she had to get some physical therapy on her knee because she hurt it. And the physical therapist was such a sweet lady. But one day she said to her, you're such a peach. And it was so sweet, but my daughter became very upset with it about it, because she said, you don't eat, I'm not a peach, you can't eat me, and kind of affected their relationship for a couple sessions. But once we kind of helped her figure it out that, you know, she did not mean she was going to eat you. But those are kind of the things that can cause confusion or frustration for our autistic individuals. So if you've met all three of those first categories, now I'm going to call it category B, you have to meet 2 out of the 4 in this next area. So this is where we're going to focus on the restricted, repetitive patterns of behavior, interest, or activities. And I do want to say, when the Diagnostic and Statistical Manual revised the manual that we use to diagnose autism, the first thing they did was everything is called autism spectrum disorders now. Level 1, level 2, level 3, which I'll talk about in a moment. But we also added sensory to the diagnostic criteria, which it hadn't previously been in the book. And I think that's huge because so many of our autistic individuals have a lot of sensory issues. So I just wanted to say that before I got started. So when you look at number 1, it's the repetitive motor movements. So hand flapping, rocking, bouncing, spinning, all of those things that are those movements that are just our kids. I mean, I've asked adults with autism, you know, how that helps them. A lot of times it's very calming. It helps them feel organized, all of those things. You'll see the word echolalia on here, so that can be immediate or delayed. So basically they repeat everything that they say. We do first responder trainings and we use a lot of echolalia examples because, you know, if you repeat everything that's said, and a lot of times it's exactly how it's said. So imagine if a person with autism is being interviewed by a police officer and the person hears, "What are you doing?" And the person with autism says that back to the police officer, "What are you doing?" If you guys want to put in the chat, how do you think the police officer is going to perceive that individual? You know, and I can't see the chat. So,
Okay.
Jeanette, can you help me?
Someone asked another question, but I'll skip over that question and give you the answers to what you just asked. The
Okay.
first person, SL, said rude.
Yep.
CS said disrespectful.
Exactly.
HS said power struggle.
Mm-hmm.
KT said disrespectful. And
Yep.
HS said non-compliant.
Yeah. So
Oh,
you see,
EM, one more. EM said rude,
mm-hmm.
mocking, or under the influence.
Yes, exactly. So you can see how that simple behavior could be misinterpreted as all the things that you guys just mentioned. Do you want to go ahead and ask the question? Or
Okay, what do you do when psychiatrists diagnose it as ADHD and only state that your child is probably high functioning and that there's no test for high functioning individuals?
So I would encourage you to probably see a psychologist that can do the autism testing. There's several different formats, or autism assessments. So for example, depending on the child or the adult, we use what's called the ADOS. It's the Autism Diagnostic Observation Scale, or the ADIR, which is the Autism Diagnostic Interview. It's a little bit trickier for adults because it's, as you'll learn in a couple slides, depending on the age of the adult, and there's not that history of early development, it's a little bit harder to find out if the symptoms were present, because sometimes the adults just, maybe their family members aren't around anymore, or the siblings were young, so they wouldn't be able to report, or medical records. Most of us are only required to keep medical records for 7 years. So it becomes a little bit more of a challenge to figure out what was happening in the earlier years. But psychologists can definitely do those testing. And sometimes we just have to do get a second opinion or a reevaluation. If that at the end, when you get my phone number, if that person wants to call me or reach out to me, I'd be happy to talk more thoroughly about that. Was there any other questions, Jeanette? And I hope that answered her question.
It said for adults as well, and then it said, okay, thank you, smiley face.
Okay, perfect. So the echolalia is an example that I see kids and some adults get into a lot of trouble. I think the adults probably learn to mask this quite a bit, because they learn really quickly that this can cause them trouble. I just want to also add the delayed echolalia. So my favorite example, and this was probably 10 years ago, I was working with a young man, and he could watch a weather report and tell you he was more accurate than the weathermen. I mean, this was just his thing. He studied maps, and just hopefully he's a meteorologist now. That's how amazing he was. But when he would get upset, instead of saying I'm upset or I'm frustrated or whatever, he would go into a weather report that he heard about a hurricane or a volcano or anything that was weather related, that was like a big weather deal. And we were able to use that to kind of help with the 5-point scale and help him with his behaviors before it did get to a hurricane. Maybe it was like more of a tropical storm or a thunderstorm. And we were able to use his interest to help us with some behavior things. So it was kind of cool that we knew that interest. But when he would talk about these weather reports, it would be the exact words that you could literally hear the meteorologist's voice. He was saying the exact words, but he had heard it like a year before. So that's why we call it delayed echolalia. But it's the exact words that the weather reporter used in his report. I just find it so interesting. The same boy also liked commercials. And one day his mom spilled some milk or a drink, and he goes, "You need ShamWow." And then the whole commercial with the phone number and everything. So it's not like he heard it, right before. It was a commercial that he heard, and who knows when he heard it. So for this next bullet point, this is also where I see lots of, especially kids and even some adults with, as they're starting to learn vocational skills and job things, this is where they tend to get themselves, or where we see more behaviors. So insistent on sameness, maybe they like the same clothes or the same texture, and flexible adherence to routines. If you're driving to work, this is the only way you go. You only go this way. And if there's construction, which is all over Rockford right now, that could potentially be the thing that, causes some behavior. All of these things, ritualized patterns, verbal or nonverbal behavior, extreme distress at small changes. I know you guys can read all of this, but I think my printing's kind of small. But this bullet point here is where I see lots and lots of some of the behaviors, or this is where we're getting a lot of calls of how to help. This would be where, our kids who are pickier eaters, they're the chicken nugget guys, and that's all they'll eat. And they'll only eat McDonald's. They won't eat, frozen or something like that. For number 3, highly restricted fixed interest. So these are the they can tell you everything about a subject that is just makes their world just so happy. Or they're very preoccupied with maybe an unusual object. I worked with a young man who carried a string around for probably 5 years, and he had it in his pocket, and most of us didn't even know. I knew about the string, but it was just something that kept him very happy, and it was the same string, and he couldn't function without it being in his pocket and knowing that it was there. So, and then finally, the hyper and hyposensitivity. These are all the things, the sensory input. Some kids have an extreme high pain tolerance, so this could definitely be misinterpreted as, maybe they're sick, but they're not acting sick because they're not feeling, they don't feel the sore throat or the tummy ache or whatever. Lots of our kids have sensitivity to sound or light or things like that. So this part was actually added to the diagnostic criteria, and I believe that was in 2013. So I'm going to take a pause before we go to the next criteria and see if there's any questions.
Yes. What is the difference between Tourette's syndrome and delayed echolalia, or can they be related at times?
Yeah, absolutely. So Tourette's is the brain almost, let's see, what's a good way to explain this? Like there's no control of what the person is able to say, where echolalia is more of repeating what they've heard. So, for example, Tourette's, I'm trying to think of a good example. Maybe they're, flowing along with the conversation, pretend Jeanette and I are having a conversation, and all of a sudden I have to, turn my head and say, like, I can't control what is being said. Where with echolalia, and there is a little more control, but it's not spontaneous. And I do have a really nice fact sheet on Tourette's. And surprisingly, there's a lot of people diagnosed with autism that have Tourette's as well. So I can share, Jeanette, would it be better for me to share resources for families or with you, and then you can pass them on? Or, okay. I see
There's
another question.
another question.
Okay.
Kind of like how you said when they get older, they are able to mask it better because of the negative reactions. I guess it was a question. Yeah.
Yeah. So if so the police officer example, if that happens to you quite often and you get the feedback like you're being rude or you're all the comments that were listed, eventually a lot of times they learn, well, I just won't say nothing, or I'll wait till I'm in my safe place, or I'll do something else to avoid that feeling or that stress or whatever negative input or output that they're getting. And you got to imagine how, just reading so far the diagnostic criteria we've went through, our world is really not set up for people who have sensory issues. And we all talk with our hands, where you're talking fast, and I haven't even mentioned trauma. Just think about all of our folks who have trauma, and trauma can look very similar to some of these things that I'm talking about. ADHD lots of ADHD kids have sensory issues and some social things, but they don't meet criteria in the other areas. So, it can definitely be a struggle. And if you constantly get negative feedback, you you tend to learn how to hide those things or only do them with the people who you feel safe with. I hope that makes sense, and whoever asked the question. Is there another question? I just think I saw something.
Yes, the first comment said definitely not, all in caps. And then it said, yes, it does. Thank you. I'm not
Okay.
real sure.
Okay. Well, when I get to the end, if there's more, then I can actually read the question too. It's just when I share my screen, it's hard to see.
No problem.
Okay. So here's some more examples of the restricted patterns and interest. And these are small examples just to give you, an overall idea. I will say, the motor movements and masking, for example. I know tons of autistic people who, when they're home or in their safe place, they're rocking and hand flapping and doing tons of things, but I never see them do it when they're at our social skills group or we're doing a family fun night. So I always find it interesting that, if when they're in my office and it's just us, they're, pacing and moving and bouncing, but then when they're in other areas, I don't see it at all. So I think they're masking. I probably shouldn't make that assumption, but I feel like I see more stress and, they're just probably trying to fit in or feel accepted or whatever.
May I make a comment?
Yeah.
I have a very, very close relative who is 64 and just got diagnosed last year.
Yeah.
Now I'm looking at her in a different light, and I'm getting to know her all over again and what she can tolerate, what she can't tolerate. And I noticed when she's nervous, she rubs her thighs
Yeah.
just back and forth, back and forth, back and forth. Um, she can only people for short amounts of time.
Yep.
Just all these things that I'm noticing now, and I'm
Mm-hmm.
getting to know her all over again. And she went in to find out if she had ADHD,
Mm-hmm.
and they said it was autism and that she's on the spectrum.
Yeah.
And she's very high functioning. She has a
Yep.
professional job.
Mm-hmm.
She went through life, did great in school, but who knew she had autism?
Right.
So why do
And
women get
she's,
diagnosed so late sometimes?
because, well, for someone her age, we just didn't have the assessment tools. Women, even more so than men, mask the symptoms. And, when you're high functioning, people assume that you are super smart, and they are. I feel everybody on the spectrum is super smart, but in daily function and things like that, just imagine how much stress that poor woman has gone through for 64 years, maybe not feeling like she fits in or whatever it is. Knowing you're a professional and you're expected to behave in this certain way, and you know I'm glad you shared that, because I bet you there's a nursing home full of people with autism. I bet you there's jails full of people with autism that are either not diagnosed or improperly diagnosed. We still have a lot of work to do in this area. We definitely are getting better. But you know,
I do have a follow-up comment when you're done.
okay. I just feel like, I mean, our waiting list is 18 months for diagnostics right now. So imagine, and that's not just us, that's everywhere in, sorry, there's a page. So just imagine all the families that are wanting help, and there's either lack of providers or insurance company, they're not on their panel, or I'm probably preaching to the choir when I'm saying all this. It's just not as easy to oh, I'm going to go get an autism diagnosis. You know, if I sprain my ankle, I'm going to go to the emergency room, get an x-ray, and then I'm going to follow up with an orthopedic within a couple weeks. It's not like that for autism or many of our mental health, many of our developmental disabilities. So that's probably why.
My follow-up comment is my own daughter recently, like maybe 2 years ago, got diagnosed. Well, no, she wanted to get diagnosed for ADHD. She wanted to see. They refused to test her and said, "You're grown. What does it matter?"
Mm-hmm.
And when she did the diagnostics online, she checked every single box. And
Yeah.
she thinks that she might have some autism as well. But getting someone to diagnose a 38-year-old, they're not going to do it, most
Right.
likely. So
Yeah.
she's having a really hard time with it. And I did learn that she has been masking her entire life. And
Mm-hmm.
I'm also getting to know my own daughter differently and what makes her tick and what irritates her, you
Yeah.
know.
Right.
And it makes a difference. You have to be sensitive to the person and their needs.
Right. Well, and I feel like, so if you compare autism diagnosis to like strep throat, for example, if I have strep throat, my throat hurts, there's white patches in the back of my throat, I might be tired. So what would be the purpose of getting a diagnosis? I'm going to hopefully get treatment, right?
Yeah, right, right.
So I'm going to get an antibiotic. They're probably going to, so the test would be swabbing my throat, listening to my symptoms, and then I get, yes, you have strep throat and here's your treatment, or no, it's not strep throat, it's something else.
Mm-hmm.
So we don't have that with autism. So that's part of the problem. But if you think about the outcome, so if I get an autism diagnosis, what's the treatment going to be? Am I going to get speech therapy? Am I going to get occupational therapy? Maybe applied behavior analysis, social skills. Sometimes people just want the diagnosis so they can understand I've been going through this my whole life. There is something there that makes me mask, and now I can tell my mom or tell my family or tell my friends so they can help me, or maybe eliminate people out of their lives that are toxic or whatever. So, like I said, I'm so glad that they have someone like you that can help them walk through that. And like you said, learn them differently. And maybe some of the things you do with them is differently, you know?
Very much so, because I have been doing it all wrong for 38 years. And now I'm very sensitive and I listen and I'm educating myself. And now it's gone down to my grandchildren's generation and she sees it in my grandson as well. So
Yeah.
oh, and by the way, she was a straight A student in the gifted program. So it's
Hmm.
like, who knew anything was wrong? So the
Yeah.
last comment from EM says, I went to public school, private school, and eventually homeschool. I did well in specific subjects and struggled in others. And I was always told I was not trying hard enough.
Yep.
I was not diagnosed with learning disabilities and neurodivergent diagnoses until I was 26 years old. My PCP asked me why I would like to seek out being tested and what paras and support staff and teachers had said growing up. And I was notified, hold on, scrolling up. Um, and I was notified that there was none of that. I was in a rural area with limited funds and resources, and then homeschooled with parents that do not believe in behavioral or mental health anything. It's very liberating, but also infuriating at the same time. Sad face.
100%. That story is one that I hear a lot. And thank you for your bravery and sharing that with us, because for the providers on the phone or on the webinar, we just need to do better. You know, we need to listen more. And so just honestly, thank you so much for sharing that with us, because I'm sorry that it took so long for you to discover what you needed to. So as I move along, because I know the clock is ticking here, and we'll be done in a little bit, but so these are the three categories that we don't really read about or talk about. So in category A, remember you have to have all three of those first ones with social and communication, 2 out of the 4 that I just reviewed. And then you have to have answer yes to all of these. So symptoms must be present in early development. So that's why one of the reasons why it's so hard for adults, if there's not a person to answer that in early development. Or in the person who just commented, if her parents don't believe in that, they might say, you know, they didn't see it, or, you know, that could be an example in this situation. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. So you can have autism, and I'm not a big fan of high functioning and low functioning, because we have lots of individuals who are very intelligent and, you know, they can pull straight A's and things like that. But maybe they struggle with social emotional regulation and they're masking. So the symptoms have to be clinically significant, which means impacts their everyday functioning. So again, when you're masking these symptoms and you struggle to get dressed, or, you know, wear clothes or eat food, or any of the many things that autistic and neurodivergent individuals go through, that is clinically significant. So it's important for us to focus on, you know, if you have a hard time making friends, or, you know, you can do a job, but you can't manage the job interview, that's where we need to put the supports in place. So clinically significant is huge in autism diagnosis. And a lot of times when, you know, parents come into our office and explain their child, we really want to know what is it really like on a day-to-day situation. So, you know, we want to hear about the meltdowns and the successes too. We want to hear all of it so we can help determine, are the things that we're seeing clinically significant that impair all the areas of life, not just if it's only happening at school and no other area, then, you know, we need to look at that, like what's happening at school that's not happening everywhere else, or vice versa. Maybe it's only happening at home, but not everywhere else. And then the final thing is the symptoms cannot be described by another diagnosis. And there's several listed here. And there's many people with autism who also have an intellectual disability or a global developmental delay. So there's 5 categories when we diagnose autism. So, and even some of these could look more like ADHD, and, you know, some of the symptoms overlap, but that's what helps set apart the diagnosis for autism than some of those other things. And if you remember when I mentioned the diagnostic statistic and diagnostic manual, prior to 2013, you were not eligible to have ADHD and autism. When they revised the book, now you can have both. And there is a lot of people that with autism that have ADHD. And we're gonna see a slide here in a minute about some of the misconceptions of autism. The other thing here in this slide, these are common terms that are similar with autism. So for example, executive functioning, 52% of autistic individuals have executive functioning deficits. And executive functioning is basically the skills, if you think about what an executive needs to do his job or her job, it's organizing, planning, problem solving, starting a task, ending a task. Sometimes multitasking, even though the research shows that's not a good thing to be doing. Many of us have to do it in our work and life, home life roles. Joint attention is another area. Joint attention is probably one of the first flags or red flags that we see when somebody's diagnosed with autism. Joint attention is if you can imagine an airplane flying over and you say, oh, look, an airplane, and we all switch our attention to the airplane. That's kind of what that is joint attention. So you're sharing what's going on, your experience with another person. I did talk about language intricacies, that the idioms and sarcasms or generalizing concepts. Theory of mind, and I'll send these videos to you, Jeanette. There's a couple of videos that you can determine if there's a deficit in theory of mind. One is a cars video. So a mom shows a child a little box and puts cars in it or pencils in the car box, and she says, what do you think your dad is going to think is in this box? And it's an M&M box. So put cars in the M&Ms and the child he'll say M&Ms. If they don't have if they have deficits in theory of mind, they may say cars because that's what he sees. So I'll send you this video. It's a really cute example of how theory of mind develops around age 4. So, but where it ends up causing behaviors is have you ever heard yourself say or a teacher say, when your dad gets home, he is not going to be happy. So that's a concept that our kids or adults may not understand, that what is somebody else thinking or what are their emotions about something. So it's very interesting. It's a higher level concept. We work on that in social skills with teenagers because, usually there's other things that we're focusing on. So here's the levels of autism: level 1, level 2, level 3. Level 1 is typically given when the greatest deficit is in that social interaction. That can have some issues with organizing, problem planning, time management, things like that. We're level 3, and this probably, if you're familiar with Asperger's syndrome, this is where level 1 is very similar to Asperger's. For those of you who remember that, we don't call it Asperger's anymore. Where level 3 is somebody who's more nonverbal, may have intellectual disabilities, more aloof and in their own world. And then level 2 is somewhere in the middle. So I'm actually, for time's sake, I'm going to go to this last slide. So when we think of autism, and these are usually all the areas that are tested through testing, and you can imagine you could have somebody who has more of an intellectual disability, or they could be gifted. They may be nonverbal or highly verbal. It's one of the challenges with autism, because no person with autism is going to all be on the left side or all on the right side. It's very varied in between, and you can be hyposensitive in hearing but hypersensitive in touch. So the treatment plan for each person with autism is going to vary between person. I'm actually going to send this PowerPoint to Jeanette, and if anybody wants to talk to me, because I think we only have 6 minutes left, and I can go through it and we'll do the PowerPoint together or whatever, if that's okay. Because I know for time, do I have till 1 or 1:30?
1.
Till 1. Okay. So here's some of the common co-occurring conditions that are diagnosed often with autism. So 84% of individuals with autism may have anxiety, and that was from Cleveland University. I got that percentage. Depression is often 26% of people with autism compared to 7% of the general population. And I really see this definitely around puberty. I see more kids diagnosed with autism or depression and autism. Not little ones, but where I see a lot of the constipation, diarrhea, a lot of that gastro stuff going on with littler ones, but it definitely can affect older ones too. Epilepsy, up to 35 people with autism also have epilepsy. 7% with metabolical disorders. So it's higher in individuals with autism. Sleep disorders, I think this is staggering. 50 to 80% of children on the spectrum may have one or more sleep disorders. I went to a training about 2 weeks ago, and it was an expert on behavior. And this gentleman said before he does anything, medication, any interventions, he does a sleep study. And almost all of the clients he saw are sleep deprived. So they have to address the sleep before, because it's not getting sleep does something to your brain and your functioning. So that's where he starts. So the next couple slides are different interventions available for autism. Like I said, I'm going to send this to Jeanette so she can have it all and share it with you all. I did add some things to consider when you're evaluating interventions. Not every intervention is a perfect fit. Not every clinician is a perfect fit. So, sometimes, sadly, in our community, there's only one provider that offers the service. So you may have to, be patient as you try to figure out things. So I wanted to just briefly talk about the myths, and the one person that made the comment made me think of this. So myth number 5 is the one that I really want to focus on. All autistic people, and then you can fill in the blank. So when there's that generalization, all autism people are gifted or are, I've heard everything to they're all savants or they're not loving or I don't know, I've heard some crazy things over the years. So that would be a myth. When you hear all autistic people, that's a myth. I do like to touch on bad parenting. I have so many parents come in that say, they feel like their parenting has caused the autism. That's not true. We all could learn to be a little more patient and a little more consistent and things like that, but that did not cause the autism. And even back in the 1940s, when autism was starting to become part of the diagnosis and the DSM, there's a thing called refrigerator moms, and it was believed that the moms were very cold and just not nurturing, and that's what they thought caused autism. That's not true. Autism can be cured. We know that's not true, but we know with a lot of interventions, and the goal is to help people reach independence to their capability. And that's going to look different for every person on the spectrum. Oops, I doubled that slide, so sorry. Here's a resource page. And again, I'm going to email it to Jeanette because then you'll be able to click on the links. After Easter Seals in the Autism program, I love this Echo Autism. It's a bunch of university partners that have gotten together and put resources in this really nice website that's all together. So you could type in adult resources or whatever. But all of you are more than welcome to contact me. And if I don't know the resource, I will connect you to the people that do. This is my contact information. We'll get that to you. This is a flyer of all the services we offer here at our program. These are all the services offered from Easter Seals as a whole. These are other TAP partners throughout the state. There. Okay, I got it at 1, but are there any questions, Jeanette?
No more questions in the chat, but I would like to tell everyone out there, if you want any of this information, email me at Jeanette, JeaNette, at NamiNorthernIllinois.org, spelled out. That is Jeanette at NamiNorthernIllinois.org. And I will send you the information as I get it from Lori. And Lori, I want to say thank you for all of your time, your information, your expertise. This was amazing.
Thank you. And
Thank
please,
you.
anybody on the call, please email me, call. We're here to help you navigate whatever it is. And thank you for everyone who shared on the chat. I always find it, people are so brave, and you don't know that you might be helping somebody else by your statement or question. So thank you.
Thank you all. Have a good day.
Thank you.